Today I'm pleased to be here with my colleagues, Senator Chris Murphy and Senator Tammy Baldwin, to introduce the Choose Medicare Act. Out in my town halls in Oregon, and I hold one in every county every year, I hear continuously folks saying, why can't we have a simple, seamless, stress-free system? They want to know why they're still being gouged by high drug prices. They want to know, why can't we choose Medicare, a simple existing plan? Why can't we do so on the exchange? Indeed, the Choose Medicare bill lays out that opportunity, a Medicare option for all. It addresses the high drug prices by giving Medicare the ability to negotiate for people on traditional Medicare as well as in a Medicare option on the exchange. Every American deserves the peace of mind to know that if their loved one is sick or injured, they're going to get the care they need and they're not going to end up bankrupt in the process. Now, this Choose Medicare system, it drives down the cost of plans through competition. In Oregon, we have a public option in workplace health care, and it cut the cost of health care in half. In Rhode Island, they adopted the Oregon plan for health place work care for workers' compensation. It cut the cost there in half. This bill establishes an out-of-pocket maximum in traditional Medicare. It increases the premium tax credits to help more people in middle-income America be able to afford health care. It directs Medicare to negotiate fair prices for prescription drugs. It extends traditional Medicare protections, and it enhances those protections for populations that are served, younger individuals, women who are bearing children and so forth, that wouldn't be covered by traditional health care. This really enables people, once they have a Medicare option, to carry it with them into a future employment. And it enables employers to choose a Medicare option for their employees, thereby greatly enhancing or expanding the number of people who qualify. This is a powerful, powerful step towards a more simple, seamless system, building on the great strength of our existing Medicare plan. So with that, I'm going to turn this over to Chris Murphy, who's been a full partner from our very first pondering of how to put this together. Thank you, Chris.
Thank you very much, Jeff, and thank you for your partnership. Jeff and I are reintroducing this bill today with Senator Baldwin and many others, but as he noted, we spent a lot of long hours putting together this plan as a means to put the question of the future direction of America's healthcare marketplace in the hands of consumers. You know, if I were designing a healthcare system from scratch in this country, I'd design a single-payer healthcare system. To me, it's obvious that Medicare is the most popular, most affordable, best quality insurance product out there today. It's ridiculous to me that you have to wait until you're 65 or until you become disabled in order to have access to the most popular insurance product in this country. So at the heart of this bill is a really simple proposition. Everybody should be able to choose Medicare if they want. And it's my belief that this bill and this proposal is the way to test the proposition that Medicare is the best plan for everyone in America. If Medicare is indeed the best insurance plan in the marketplace today, then individuals and businesses will choose Medicare. And over time, the marketplace will decide that America is going to gravitate towards Medicare rather than private insurance. To me, it is much more politically palatable and much more natural to allow consumers to make the decision as to whether we become a Medicare for all country. And the Choose Medicare Act allows for that to happen. As Senator Merkley noted, we put a lot of thought into this bill. One of the things we've heard loud and clear from families today that are on the healthcare exchanges is that the out-of-pocket expenses are crippling them. And so what we've done in this bill is take some of the savings that you achieve by expanding out Medicare to more people and putting them into affordability. What do I mean by that? Because we allow for Medicare to act like a private insurance plan and negotiate directly with the drug companies and providers, it will save Medicare and the federal treasury and the trust fund billions of dollars. We take that money and we put it into cost sharing to defray the amount of money that families are putting out today on the exchanges and put a out-of-pocket cap on the Medicare program. Those savings are available to us because we are allowing Medicare to use all the tools that the private sector uses. This bill puts Medicare on equal footing with private insurers, offers them side by side to consumers and businesses, increases choice for employers and for families, and uses the savings to be able to increase affordability. I think that this plan has the ability to unite Americans, some of whom may not be ready to, to adopt a Medicare for all system overnight, but who do want the option to be able to choose for themselves whether they want to get into the Medicare program and can't today because we reserve it for only a handful of Americans. So I'm really excited to be introducing this today, again, with a big group of our Democratic colleagues, no Republicans yet, but I'd be really glad to introduce one of our co-sponsors and somebody that I've worked with for the last 6 years on protecting and advancing American health care, Tammy Baldwin.
Thank you. May 4th, coming up this Saturday, will actually mark the 2-year anniversary of the House Republicans passing legislation to repeal the Affordable Care Act. And many may recall the spectacle of the Rose Garden get-together, the celebration, the backslapping, the high fives that occurred at the idea that they had taken the first steps towards taking people's health care away. Instead of working in a bipartisan manner to fix and improve the Affordable Care Act, Senate Republicans tried to pass repeal bills as well. And the Trump administration has spent the last 2+ years sabotaging the Affordable Care Act and the healthcare system in general, raising healthcare costs, pushing these junk insurance plans that do very little to cover people, including having the right to deny people coverage if they have a pre-existing health condition. You know, the president has no plan to protect people with pre-existing conditions, and I have to say I doubt he ever will. Now, President Trump has ordered his Attorney General, the Department of Justice, not to defend the Affordable Care Act in court. In fact, he's ordered the Attorney General to go to court and argue for the Affordable Care Act to be struck down, stripping health care away from over 20 million Americans. This lawsuit threatens to take away guaranteed health protections and raise costs for the people of my state with pre-existing conditions. In Wisconsin, I will mention that we have more than 2 million people with some sort of pre-existing health condition that could stand to lose their health care protections. This past weekend, I met with some of those Wisconsinites, and they want to know why the president is working to repeal their care and take away their protections. They're frightened. They're frightened because if this lawsuit succeeds, insurance companies will again be able to deny coverage or charge higher premiums for more than 133 million people in America with pre-existing health conditions. So the people of Wisconsin did not send me to Washington to take people's health care away. In fact, they sent me back here last fall because they want health care that they have now to be protected, and they want us to work together to expand access, and to lower costs. I have always supported universal health care, and it's why I support a number of different paths to expand high-quality coverage. And today, I am so proud to be joining my colleagues, Senators Merkley and Murphy, and others, to introduce legislation that offers a new option for every American to buy affordable, quality health care coverage through Medicare. The Choose Medicare Act would give every individual who is not already eligible or enrolled in Medicaid or Medicare the opportunity to enroll in Medicare. It would cover essential health benefits and all the items and services that are covered currently by Medicare. In addition, it would open Medicare to employers of all sizes and allow them to purchase high-quality, affordable health care for their employees instead of or in addition to private insurance. This legislation would be a critical step forward to help reduce health insurance costs and increase competition, and it will drive down private insurance premiums with competition from Medicare. We absolutely need to work across party lines to make healthcare more affordable and give people more choices to find quality, affordable health insurance. This legislation would do that, and it's yet another example of how Senate Democrats are working to guarantee affordable health care for every American. The choice for the American people couldn't be more clear. We want to make things better, and our Republican colleagues have sadly done everything they can to make things worse.
Making things better. That sounds like a good way to go. Do we have any questions? Yes.
Do you have any analysis or expectation of how many employers you would think would transition their workers to this type of plan? Have you done any analysis of that?
No. What we do know from looking at public options in the workers' compensation space is that employers were quick to adopt the public option in Oregon and in Rhode Island. I recently met with the Portland Business Association, and as we were talking about health care, I did a little poll of the people in the room, and 2/3 of the folks raised their hand that they had chosen the public option in Oregon. But I think you find with this sort of thing that a few employers try out something, see how it works, they become the folks who suggest to others that, hey, this is a good idea. It's a testing in the field of competition, and the results determine how fast we go forward with adoption. I will mention that a concern that has been expressed is what happens if the sicker population in America chooses the Medicare public option rather than competing plans. And the answer is reinsurance. And we have strengthened the reinsurance provisions in this year's edition of the bill. Anything you all would like to add?
No, I think you're right, and remember this. Our proposal stands on the shoulders of the reforms inside the Affordable Care Act, and so when you layer this new option on top of the requirement that everyone take all comers, regardless of their history of illness, and when you require everyone offering insurance to cover the essential benefits, you also guard against that kind of risk loading in Medicare, because Medicare is going to be covering the same set of benefits that the private insurers are going to be covering. So we do have a reinsurance pool here in the case that you have a sicker population in Medicare, but theoretically there's not necessarily a reason that would happen, given that everybody has to cover the same benefits, and you can't exclude any individuals because of their medical acuity.
Senator Murphy, I'm wondering, I believe I heard you say that in the best of all possible worlds, Medicare for all would be the way to go, but this is kind of politically palatable. Could you clarify a little more? Is this really a better plan? Is this the best plan out there?
I think
or is this just a compromise?
Sure. Well, I think what's interesting to note is that amongst the co-sponsors of this bill are senators who have sponsored Medicare for All. I think both Senator Merkley and Senator Baldwin have, and senators who have not, which would include me. So, you know, I think that what is most exciting is that we are talking about serious policy proposals to get us to full universal coverage in this country. And so I think this is a really important moment for the Democratic Party to have an open discussion about what the best means to full universal coverage is. I have not signed on to the Sanders bill because I'm fairly confident this is the path to get us to a system that costs a lot less and ensures a lot more people. But I'm glad that so many of my colleagues who are supporting this have supported other measures. It shows that our caucus is open to a really, you know, a really wide-ranging debate moving forward. You know, but when I have lots of people in Connecticut who, you know, come to my town halls and are angry that I, you know, haven't supported other bills. You know, but when I tend to, you know, do that same poll that Jeff has done, or a similar poll, when I ask people whether the people want the opportunity to be able to buy into the Medicare program, you know, there's very few people that don't raise their hands, even in very diverse political crowds.
Just a quick follow to that, and that is your colleague Senator Blumenthal is on the Medicare for All side. But he says, you know, my door is open, I'm willing to listen, I want to do what people in Connecticut want, and so on. And he also further characterizes his support of Medicare for All as just sort of pushing the envelope forward, you know, pushing the ball down the field, you know, pick your metaphor. Why don't you do that? I heard you just say
Right.
you don't want to, but why not?
Well, you know, this is not the only proposal that I've supported. So I have also supported a Medicaid buy-in bill supported by Senator Schatz. So, you know, I do subscribe to the notion that it's okay to have feet in different camps. You know, I guess just me speaking, I mean, I tend to think that this is the fastest route to get to a universal coverage system. I personally, you know, I worry about how long it may take us to, you know, adopt and get signed a Medicare for All bill. I misspoke and said we had Republican support for this bill, but when I think about the kind of proposals that could eventually get Republican support, you know, I tend to think buy-in proposals are more likely to be able to draw Republican support, if not here, you know, out across the country.
As somebody who has definitely supported a variety of approaches to expand access, I just want to reemphasize the point that everybody who caucuses with the Democrats in the United States Senate is pressing in the direction of greater access to coverage and lower costs. Whether that's the fight we take on in trying to lower prescription drug costs, trying to lower premium costs, et cetera. And I think it's a really exciting time that we have such a presentation of varied ideas and that we have a debate. And it's not just a debate within the Democratic Party. I have to say this is a debate that we're having with the American people. I just wish the Republicans would show up and be a part of this constructive debate because, as I pointed out painstakingly, and I can add some more things, that right now there's been a legislative attempt to take away 20 million people's health care. There's been administrative sabotage, and there's now a court case. And all of this has real impact. Even if they haven't done it, we are seeing fewer people enrolling when they decrease the enrollment period and don't fund navigators. We're seeing you know, barriers being placed in front of people who want affordable health care for their families. That's the real contrast, is they're not showing up to propose something at all for the American people.
I want to add to this pondering of how you move in the direction of a public system essentially founded on the principle that health care is a right and that it should be affordable and accessible to all. We know that other developed countries spend about half of what we spend and have health outcomes that are better. So we know we can work towards a better system. Some have proposed that we have states pilot some version of Medicare for all so that that state can check it out, road test it, create an example, and build political momentum elsewhere. That's similar to what happened in Canada. In the Medicare for All bill, it takes a multi-year approach and says, let's go by age, from age 65 to 1 year to 55 to 45, and then to all. This is putting another approach on the road in which no one is told you must transition from a health care plan that you currently say you like to another one. You get to decide, you road test it person by person. And I'm really pleased that Democrats are exploring all of these options, because when the moment comes and we have a more representative democracy, one not corrupted by dark money and gerrymandering and voter suppression, we're going to embody the will of the American people to build a far more effective healthcare system. And it's important to put these ideas out there and lay them out for consideration and conversation. I just really want to echo the point that Senator Baldwin made, that this should be a bipartisan discussion. People want good health care, whether they're in a blue state or a red state.
Wondering which of the 2020 Democratic presidential contenders in the Senate this bill would be.
So Senator Booker, Senator Harris, and Senator Gillibrand.
15 sponsors in all. Well,
Thank you, everyone.
Thank you all.
Thank you. Great. Is that one's mine?